our request, took his time off and made it convenient that he's able to address on live video address. Let me introduce Dr. Tedros, Director General WHO,
requests.
a person who, whenever I have interacted with him, has always sort of given a very positive energy, a message that yes, there is something which needs to be done when it comes to the health of the world. And when he had addressed during this World Health Organization Executive Board meeting, he also very specifically highlighted that of the three pillars of reform of WHO, digital health is going to be one of the most important pillar which he has prioritized in terms of reforming WHO, also in terms of ensuring that WHO takes up its activity where the general program of work is also monitored through the digital health interventions. And it is this vision, it is this thought process, it is this energy which Dr. Tedros has always been giving, the passion which he has shown, and this being the reason we feel that in the days to come, we'll probably have a WHO which is a future-ready WHO, which is a tech-savvy WHO, which satisfies to the need and demands for future in terms of ensuring that no one is left behind. With these few words, I would request DG WHO kindly to give his address to all of us, and we look forward for your message, sir. Thank you.
Yeah, thank you. Thank you so much, my brother, Dr. Agarwal, for that very kind introduction. And excellencies, ministers, excellencies, ladies and gentlemen. First of all, I would like to say almost it's a midday here, but for you, I think it's an evening, so good evening from Geneva. And I'm really sorry that I can't be with you in person in New Delhi, but I'm with you in spirit. And as what Dr. Love Agarwal said, digital health in WHO is one of the pillars for transformation. But although I cannot be with you for this very important summit, I'm delighted that WHO is represented by my sister, Dr. Poonam Singh, our regional director for Southeast Asia region, and our also chief IT officer, Mr. Bernardo, and other colleagues from WHO headquarters. And I would like to use this opportunity to thank India for hosting this very, very important summit, which will define the future of digital health and its use in healthcare. You all know that digital technologies are transforming healthcare, and digital technologies are not just the latest trend. They are a vital tool for strengthening primary care, achieving universal health coverage, and achieving the sustainable development goals. Digital diagnostics enable us to test for diabetes, HIV, and malaria on the spot instead of sending samples off to a lab. 3D printing is revolutionizing to the manufacture of medical devices, orthotics, and prosthetics. Telemedicine, remote care, and mobile health care helping us transform health by delivering care in people's homes instead of in hospitals and clinics. Some countries are using drones to deliver blood, vaccines, and other medical supplies. Artificial intelligence is being used to give paraplegic patients improved mobility, to manage road traffic, and to develop new medicines. Machine learning is helping us to predict outbreaks. Big data and real-time information systems are helping countries to plan and forecast like never before. The future of health is digital, but we must make sure that the innovation and technology help to reduce the inequities in our world, instead of becoming another reason people are left behind. We must be guided by evidence, not seduced by every new gadget. That is where WHO can play a vital role. At the World Health Assembly last year, WHO's member states asked us to develop a global strategy on digital health. Next month, WHO will publish our first guideline on digital health. And this is just to start the start of a much bigger effort. Excellencies, ladies and gentlemen, I now leave you with 3 requests, which are actually reflected in the Delhi Declaration. First, every country must develop a clear strategy on digital technologies based on national priorities. This is not a simple task, as it takes time and trust to build consensus. Second, financing and sustaining digital health initiatives can be expensive. Countries must make careful, targeted investments based on national health priorities. The most effective technologies are often the simplest and the cheapest. Countries must also invest in building capable workforce to use technologies effectively. And third, this is not a job for governments alone. Strong public-private partnerships are needed with financial institutions, telecommunications operators, and tech companies to ensure technologies are scaled in the most effective and efficient way. Digital health will be a key area of work for WHO in the coming years. We're investing in this area to ensure we support countries with evidence-based world-class advice. We're committed to working with you to harness the power of digital technologies to promote health, keep the world safe, and serve the vulnerable. I thank you. Namaste. Thank you so much, and thank you again for joining you virtually. I wish I could have been there with you, and I wish you all the success in your deliberations. Thank you so much.
On behalf of all my colleagues present here, let me convey my thanks to you. And I think in the spirit of digital health, you probably also decided to talk to us digitally. So this is a testament to how technology can help. That since you could not travel, but still you could be with us and in conversation. And I think the message which you had given to us, primarily in terms of the fact that future of health is digital, and second is that digital intervention should also lead to equity in this world. We take forward your message, and I'm sure the deliberation of today, tomorrow, and the symposium the third day, we will also keep you posted on the deliberations of what happens here, and we would like to involve WHO in all our endeavors as member state to ensure that whatever interventions take place, they become equitable for the world as a whole. I really thank you for taking time off to come and address to this whole gathering where 34 countries representatives are present today. 9 honorable ministers had flown down from all over the world to be part of this conference. I really thank you once again. Thank you very much, sir.
Thank you very much. Thank you, Lev.
Yeah, thank you once again to the Director General WHO.